Here are some pregnancy massage facts. With pregnancy massage, it's one of the more beneficial massages out there, especially for the pregnant mom and for the baby. So you're basically getting two massages for the price of one. With pregnancy massage, it helps relieve all the aches and pains and cramps and spasms that a pregnant woman would be going through. One of the beliefs behind a lot of massage therapists is not to massage the first trimester. I mean, everybody's belief is a little bit different, but the main reason why some therapists don't massage in the first trimester is just because um, it's more likely high risk during that time for miscarriage for the baby. So that's the main reason that massage therapists sometimes stay away from that. But I know some pregnancy massage experts are totally okay with massaging during the first trimester. So again, it's all what your belief is. Um, Other options are if the if the pregnant woman is high risk, make sure you get a permission from a doctor. So that's a definite given. So again, if they are high risk, like gestational diabetes or you name it, any kind of problems that they're more likely seeing a doctor, that's when you want to get permission from the doctor, and a written permission is the best thing to get to, just to be safe. But make sure the client signs a waiver so you're able to talk with the doctor just in case about any kind of questions or comments. So legally you can't talk to their doctor unless you get some kind of written permission. Then it's okay to speak to their doctor then. With pregnancy massage, it's some of the possible problems during pregnancy. Let me just list them off. Reduced circulation, plasma increases, blood volume increased, may develop varicose veins. Um, most most pregnant women and women in general kind of dread the whole varicose veins thing. Gestational edema. Gestational means just during the time that they're pregnant. More than likely, it's going to be in the ankles is the biggest one. My wife, when she was pregnant for both kids, both my daughters, her wrist, she developed carpal tunnel just because of that. But she didn't have any swelling in her ankles, so that was weird, but it was just in the wrist that she had those kind of problems. Preeclampsia is hypertension in the protein in urine, and can cause pitting edema. So pitting edema is when you push in to here, lift it up, and it's still indented, so that's considered pitting edema. But again, we as massage therapists can't diagnose. And hypertension is increased 30%. Problems breathing in second and third trimester just because the baby's pushing up on those areas. Vaginal infections or bleeding. Gums extra sensitive. Gestational diabetes, and sometimes it will go away once they give birth, and sometimes it won't. So again, gestational means just during the time that you're pregnant. Tender breasts, that's a big way that a lot of women notice that they're pregnant, is when their breasts are a little bit more tender. Different changes in the skin. My wife usually has perfect skin, but whenever she was pregnant both times, she broke out in acne really bad. Vitamin deficiencies, that's why they want you to take the prenatal vitamins. And more vivid dreams, so the dreams seem really real. Extra sensitive to hot and cold, so just be aware of that. And probably the worst time for a woman to be pregnant is during the hot summer, humid times like that. And hard to stay focused, so it's totally understandable if it's hard for them to stay focused then. Decreased bladder tone, so it's harder to hold the urine, so that's why the Kegel exercises work really good, so it contracts the urine then. Cramping in calves is huge, so sometimes it's a potassium deficiency, but a lot of stretching in the calf region works wonders. Weight gain, average 25 to 30 pounds, and that's pretty common, but I've heard of people even gaining over 100 pounds and stuff. So back problems, of course, fatigue, hyperirritable, external rotation of the hips, so kind of walking duck-legged. Many trigger points, strain in joints, constipation, of course. Morning sickness, 2nd through 14th week. And that's kind of a farce. I look at that. My wife, she had morning sickness throughout the whole pregnancy, and it wasn't just in the morning, it was pretty much all the time. Heartburn, too much movement and ligaments, tendons, and fascia. Scoliosis problems, thoracic outlet syndrome. So thoracic outlet syndrome, it's the last two pinkies usually tingle, and it's the scalene muscles or the pectoralis minor that could be impinged that's causing that. Headaches, of course, cravings. I've heard of people even craving dirt or foam or all these weird kind of things, but um, those kind of things can happen. Excuse me. Here's a possible high risk for pregnancy: lung or liver disorders, so severe anemia, convulsive disorders, abnormal fetal heartbeat. That's a huge one. So if the mom notices that the baby doesn't move as much one day than the next, get it checked out by a doctor, because sometimes the cord could be wrapped around the neck, those kind of things. But the mom usually knows better than anything. So the baby usually is on some kind of schedule for movement, but if it's not moving that day, definitely get it checked out by a doctor just to be safe. Lupus, if the pregnant woman has lupus, it can cause problems. Poor lifestyle habits like drug use, poor nutrition, those kind of things. Too low a weight gain, but if they're overweight to start with, they're not as concerned then. Severe abdominal pain, inability to keep any food down for 24 hours. Blurred vision, so that's why really pregnant women cannot get their eyes checked, and they cannot get new glasses because the vision changes so much during the whole pregnancy thing. Sudden and severe swelling, especially in the face. Constant or severe headaches. Blood in the urine or painful and burning urination. Fever of 101 degrees Fahrenheit or greater. And chronic hypertension. Previous problems in pregnancy. Previous miscarriages. Mothers under 20 or over 35 could be possible high risk also. And previous multiple births, diabetic mother, cardiac disorders, and no prenatal care. So all those kind of things, get permission from a doctor before you actually massage, just to be safe. And here's some postpartum problems that the pregnant woman could possibly develop after they give birth. Infections, including urine, bladder or kidney infections, excessive bleeding after delivery, pain in the perineal area, the area between the vagina and the rectum, vaginal discharge, swollen breasts, breast infection or clogged milk ducts, and stretch marks, of course. So those are some kind of things to watch during the whole pregnancy process. So just make sure the pregnant woman explains to you about all these kind of problems that they are actually having. So the more information you have, the better, so you can determine whether to give them a massage or not. And typically when I have my business, I schedule an hour and a half if possible for a pregnant woman, just because it takes a little bit of time to move around. Also sometimes they have to get up in the middle to go to the bathroom, so you can even schedule for an hour and a half, or just schedule a little bit of extra breaks afterwards so you don't have to rush so much with a pregnant woman. And they say to typically have the pregnant woman lay more on their left side is the best, because it relieves tension off the inferior vena cava. But again, it all depends on what the doctor actually says. So some doctors are okay with the pregnant women laying on both sides. And on the back, in the second and third trimester, it's better to elevate their head, and then you can raise up their legs too. So you can get a big wedge to put underneath there, but I myself usually have at least 3 pillows underneath their back and neck to raise them up, to make a wedge. So I put the pillows in there in the fitted sheet, so it raises it up. And then for side lying, you want to try to keep the hips and legs and the side as straight as possible. So you want them to hold onto a pillow, put one pillow between their legs. Even one of those big huge body pillows works wonders. And if they feel like they're rotating too much, you can put another pillow underneath their knee to stabilize that. So make sure that their leg and hip and side are as straight as possible. But the main positions are just side lying and semi-reclined. Again, semi-reclined is where their head and their chest are up and their legs are up a little bit. So the reason why you want the legs up some, so it reduces swelling in those regions. And some people's belief is the pregnant woman is like 2 to 3 times more likely to develop blood clots in the legs because of poor circulation. So that's why I try not to use deeper pressure on the legs, and make sure you know all the kind of medications that the pregnant woman is on, just to be safe. But the only real advice I can really give you with pregnancy, for pregnancy massage, is ask them what's going on with their own bodies. So they're going to be the best indication whether they should receive a massage or not then. So again, if in doubt, refer it out and ask their doctor, or have them call their doctor, and have some way to verify that then too. So thank you, and leave any kind of comments, any kind of things you run into with pregnancy massage in the comments below, and thank you very much.